Hello everyone, my name is Viviana Serrano. I am a veterinarian, zoo technician, and today we are going to talk about the care of our 7-year-old pets or our dogs and cats that are already grandparents. As we know, a dog or cat over 7 years old has totally different needs than a 1-year-old dog or cat. The conditions change for them from food, habits, or even their behavior can change. So how can we help that the quality of life of our senior pet is the best until the last days that accompanies us? First, we must, and it is important, to have them sterilized before the age of 5 years. This will prevent diseases such as cancer in dogs or kittens. In the case of males, we will prevent diseases such as testicular cancer or prostate diseases. So having them sterilized before this age will help us to give a better quality of life to our pet. What else should we consider to help your quality of life? It is important that they require much more specialized and routine veterinary checkups. When we check a 1-year-old patient once a year, patients, whether it is a dog or a cat, older than 7 years old should be checked at least twice a year, because this allows us veterinarians to do preventive medicine, which is to anticipate the appearance of diseases. It is to anticipate the onset of the disease and thus make an appropriate treatment before this disease, which are usually silent in pets, detonates and generates something that we veterinarians cannot control, and then we have to reach conditions in which we are forced to do nothing for the pet. It is important to do checkups twice a year for these pets and to have blood tests, because this allows us to reach a much more accurate diagnosis and to be able to make a much more complete treatment. What symptomatology or what changes do we see in a pet older than 7 years? In dogs, it is generally common to observe a thinning. We will notice a white coloration in the eyes. The skin will have warts, growth in the skin as small masses. Some dogs stop exercising as much as before, and this is due to joint pain that they start to present. In cats, the signs of old age are not so marked. They usually get fatter because they have been neutered at an early age. They also become lazier. They even sleep much more, so it is like what we notice. In cats, old age does not manifest itself with as many symptoms as in dogs, which are more visible. Now, in diseases in the dog, it is very common for us as veterinarians to find heart disease. We are finding heart murmurs, cardiac arrhythmias. We are also finding patients sometimes with renal diseases, hormonal diseases such as hypothyroidism, hypercorticism. In acute or chronic cases we find tumors or some type of cancer that is specific in certain breeds such as the boxer, which has a very difficult old age and is a patient that due to its genetics has a predisposition to generate cancer at a very advanced age. That is in the case of dogs. In the case of cats, the most common disease is renal disease. It is the most serious disease in these pets, especially in older cats. We are going to have renal failure, diabetes, which is also a common disease that we find in our older cat patients, and obesity, which is also considered a disease, and this will lead us to other types of diagnoses such as degenerative joint disease in the cat. How can we help? First, we are going to have to make changes in the food. The diet that our pet used to eat before the age of 7 cannot be the same as the one we eat afterwards. So there are many types of diets on the market that can help us with that treatment for pets. These types of diets are designed for these patients for the requirements that they need at their age. We are talking about these diets come with glucosamine and other aspects that help protect the joints. In the case of cats, it comes with a protein more designed to preserve urinary and renal function. In the case of dogs that sometimes start to present a cognitive deficit, this means that they start to forget things that we have taught them, or they start to become aggressive, or they start to have behaviors that we have never seen in our pet in their whole life. There are diets that help with this. They help to avoid cognitive deficit or brain aging. That is why it is important to be able to help our pet at this age with a change of diet. Something that we also observe in older patients is an oral problem that is very common because they have never brushed their teeth since they were small. So the oral health of our elderly patients is very important to take into account. They are patients who are a little more complex to anesthetize. So it is important that we always do a medical checkup to be able to evaluate all these diseases and to be able to start treating them. The conditions change. We have to see that this is a patient who will not want to do the same exercise as before. The idea is to offer him a much calmer, much more comfortable environment. It is a patient who will want to sleep more, so we try to offer that comfort to the patient. We have to keep in mind that these elderly patients must continue with the vaccination and deworming plan, the latter every 3 months, while vaccination remains annual in both dogs and cats. Since the immune system of these patients changes, then they are more prone to suffer or acquire a disease, as it is much easier for these patients to acquire viral diseases. In dogs, for example, they can acquire canine distemper, which is a disease that has no cure and has symptoms that are very difficult to treat, and we reach a time when we can do nothing for it. So it is very important that we maintain a care with the dogs that are grooming and bathing, because we must continue the same. They must continue to have this care and hygiene of their hair, skin, nails. The fact that they are old does not mean that they will not continue with their care as they were when they were young. On the contrary, it must be a much more specific care. It must be a closer care for him. It should help with the diet to give the patient a better quality of life. Let's always remember to take them to the vet twice a year to prevent diseases that are appearing. Taking tests is very important. It is a great tool for the veterinarian to be able to take blood tests, because this will help the patient and treat their diseases and make them have a better quality of life and help them live much longer. Remember vaccination every year and deworming every 3 months. We hope this information is useful for you. You can find us on social networks on Facebook as Consultorio Veterinario Dr. Pets and on Instagram as Veterinaria Dr. Pets. Thank you very much.